And sir, I think we may be live. I just want to double check for any technical concerns.
Okay.
I don't see us yet. Keep checking. I think I've just gotten the signal. I see individuals coming in. And there we are. Welcome everyone to another live edition of Real Talk produced by your award-winning Let's Talk America with host Shayna Thornton radio and podcast. I'm Shayna, your executive producer and also on-air host, and super excited to be with you on this Sunday night. And you know, we always seek the best and the brightest advocates and experts out there. And I don't need to tell any of you that October is Breast Cancer Awareness Month. And it's certainly a disease and a condition that's affected everyone I know. If it's someone not in your family who had it, it's a family friend, someone from your church, from your civic group, wherever you are. I think we all know some survivors, and we probably also know individuals that have lost their battle with it. But October 2024, there's so much things that are on the cutting edge when it comes to treatment. And I'm no expert at this, but tonight I'm so honored to have someone on. It's his world debut here with Let's Talk America Radio Podcast. It's the one and only Atlanta Metro based breast surgical oncologist, Dr. Christopher Jean Louis. Dr. Jean Louis, welcome to the program, sir.
Thank you so much, Shayna. Thank you for having me. And it's a true honor and a privilege to speak with you and your guests on this podcast.
Thank you, sir. It's super exciting to have you on. We all hate the word cancer, right? You've treated a lot of it, but I think what's so much more important for all of us, because the fear is there, and you know this better than I do, and we will talk about your patience and fear, but it's also to be aware and to be empowered and to be educated. And I think that's the part of all of this in October. There's so many things, so many great activities that we see going on. But what I would love to see is the education and awareness to continue to go on. And that's why we sought you for this program, sir. We're going to get right to the questions. But before we do, I've seen your CV. I know your resume is super impressive. But for the next 2 minutes, I want you to join us. And what all of our experts do on this show, it's a tradition where you get to talk, Dr. Jean Louis, about your personal journey, your personal fight to really make sure that as many individuals as possible can become cancer free or certainly thrive within their destiny. So, why did you go into this field? Because obviously, a very bright gentleman, you could have gone into a lot of different areas of medicine, but why breast surgery and really addressing women with many conditions, including breast cancer? Take it away, sir.
That's a fantastic question. Um, and it started pretty early in my training, specifically during residency. When you finish med school, you go to residency. And of course, I went to general surgery residency. And I had the opportunity to be involved in the care of two individuals, two young ladies, pretty much from the initial diagnosis. I followed these two young ladies throughout treatment, and then would see them, clinic visits for surveillance, but just kind of watching that process, watching their journey, and then
Yes.
watching them overcome this breast cancer diagnosis and thrive afterwards.
Yes.
Um, these two ladies, very early in my residency career, they really made an impression on me, and it really blew me away. Um, I think the other thing that I thought was very special is with breast cancer and other cancers as well, but with breast cancer specifically, care is very individualized to that
Yeah.
individual. So your treatment, your regimen may be different from the next person's treatment and regimen based on a number of factors. You as a person, your health, your cancer specifically, but also other factors, psychosocial factors.
Yeah.
So it just a lot goes into taking care of that individual who is diagnosed with that breast cancer, and your plan is designed specifically just for you. All right. And then, a lot of folks call me crazy, but with breast cancer, I truly, in my heart of hearts, believe that this will be one of the kind of major cancers that'll be 100% curable,
Yes.
potentially within our lifetime. I
Wow.
yeah, I think a lot of hurdles to overcome, a lot of obstacles to kind of go through, but I think it's our survival rates are fantastic. They're only getting better. New data, new treatment modalities are coming out. So I think we on the cusp of maybe turning that corner where, a cancer that's so commonly diagnosed is nearly 100% curable.
Yeah, I love to hear that. I love to hear your enthusiasm about the hope of this disease that has impacted so many people. Obviously, I know warriors who have survived, and I also know individuals who have lost loved ones to breast cancer. And obviously, no one wants cancer of any sort. But obviously, I think we're in a time now where there's so many more options that simply were not there or viable 30 years ago. So we certainly all can get to that. I want to let everybody know, if you're a lady or you're a gentleman, I don't care who you are, if you're listening to us right now and you've ever wanted to have a medical expert, a breast surgical oncologist sitting in front of you, right? And you may not have even ever had a cancer scare of any sort, but you said, I'd like to know this. I'd like to know if this is family related. I have a third cousin that has it. This is your opportunity. I'm asking you to put your questions or comments, or if you agree or disagree, in our chat right now. And I want our men to as well. Okay. I want our men to, because I don't want men to shy away from this conversation, because I'm going to ask him if there's a genetic component that comes from the men. I don't know the answer to that, but I can tell you this: every man knows someone that has breast cancer, and it could very well be his daughter, his significant other, his wife, his cousin, his sister. I know individuals who've had mothers who've had it. So this is not a conversation where you say, oh, this doesn't concern to me, I'm a man. Because I think if you have a daughter, you need to be listening. If you have a sister, you need to be listening, because education is key. And we never know when they could be in the midst of a physical battle and needing to have your encouragement, the education, and the awareness that you can have to give them hope. And that's what it's all about. We're going to get those questions started. I'm going to kick it off, but I want everyone, if you're listening to me, get your questions in, your concerns, any of it, and we're going to talk it, because I do want to let this be known too. And I know you're going to talk about this. There's a genetic disposition for it, but obviously there are women who get breast cancer where it doesn't seem to be documented in the family. So if you're saying I don't have breast cancer in my family, please do not be so naive and click out of this, because this conversation affects everyone. Dr. Jean Louis, my first question to you, and I don't want us to overlook this, because we throw out breast cancer, breast cancer, breast cancer, but for us in layman terms, what exactly is breast cancer and who can be affected? And I know that question, someone could be like, well, just women, but obviously there are well-known celebrities, men who've also had it. So who can be affected? And I'm assuming obviously mostly women.
Yeah. And that's yes, that's another great question. And as far as to answer the first part of it, as far as what breast cancer is, I always tell patients, and different individuals, that to break it down and make it as simplistic as possible. Breast cancer, and really any cancer in general, is pretty much cells in a particular part of your body that have gone rogue. Right?
Okay.
Through a sequence of steps, they've stopped listening. Right? Your body is very sophisticated, does a fantastic job in telling these group of cells, okay, it's time to shut down and die. Okay,
Okay.
you these cells need to grow and develop into an ear or a finger or a nail. So your body, is very sophisticated as far as dictating, kind of cell activity. Cancer cells are pretty much cells that just, like I said, through a sequence of steps, they just stop listening. And so these cells will just continually divide and multiply and make new cells. Now, at what rate that happens, that's different from person to person, cancer to cancer. But that's the whole premise of cancer, is just cells that continually divide. They stop listening to kind of the body's signals. Right. And as far as who can be affected by breast cancer, you just touched on it. Of the individuals affected by breast cancer, 99% are women,
Wow.
1% are men, right?
Wow. Wow.
So men are not exempt. Men are not exempt. There are very famous men, like you mentioned, that have been affected by breast cancer. Everybody knows Shaft, right? Everybody's heard of
Yes.
Shaft. If you were old enough to watch it at the time, you watched Richard Roundtree do his thing, and if you were, maybe that was before your time, you've at least heard about Shaft, right? Well, Richard Roundtree is a breast cancer survivor, or he was a breast cancer survivor. He was diagnosed, brought it to his doctor's attention, was treated appropriately, and he did well. Right? Beyonce's father,
Yes.
everybody knows Beyonce. Her father was diagnosed with breast cancer as well. Kind of noticed a lesion on his chest, had it addressed, had it taken care of, and he's doing well as well. So men are not exempt, and with men, it's not so much I'm more masculine, more feminine. No, Shaft was one of the strongest guys we knew about. Richard Roundtree was.
Absolutely.
So it doesn't discriminate.
No.
Um, and then as far as family history is important. It is very important. And so, with men, even though men are not as affected as much, it is important that men and women know their family history.
That's right.
Yeah. And some, families and some societies to ask about, other family members' medical history, that's kind of cliche. That's kind of territory you don't walk into.
Yeah.
But your family history is very important because family history with breast cancer, specifically a first degree relative, is very impactful and carries a lot of weight and
Yes.
affects your risk. Right? And so, knowing, I tell patients this is the time to be nosy. You know,
Hmm.
this is the time to really inquire, ask family members, what type of cancer did grandma have, and how old was she when she passed? If we've had first degree relatives, really being mindful of that because yes, family history is one of the most important factors, and that's a non-modifiable factor, so something you cannot control.
Yeah. So, and you're right. I mean, just like we have mother's eyes or father's complexion, we also pick up, to your point, the internal genetics, the cells that are there. And we certainly know, as you pointed out, there's a genetic component to cancers, not all cancers. But I do want to say, and you talked about family and asking family, and a lot of families, especially our grandparents' generation, can be very private. Those are private matters. I don't know how many times I've heard people say, well, their grandmother passed of a women's disease.
That's right.
And Dr. Jean Louis, that can range from ovarian cancer to uterine cancer to breast cancer. Not sure what a
Absolutely.
woman's disease necessarily means, but any real life tips right now for our viewers who are watching us who want to desperately ask their mother, who may be 77 years old, who's like, it doesn't matter, leave it alone. And I'm a person that's a faith, but you just pray about it. You don't need to worry about those things. And there are individuals who will say, put that in your head. You're putting that in your spirit. You're thinking of those things. What would you say when you deal with individuals from other generations or who just simply have a different set of thinking where they don't think the information is key? And we all know by now, just universally, logically speaking, it is. But how do you address that? Because they're holding the golden ticket. You
Mhm.
want it, but if they're refusing to give it up.
Yeah. And that is difficult. That is very, very difficult because despite your best efforts, you may have family members that may not share, and that happens. But I think just really, stressing to those family members, hey, I met with my doctors. They inquired about family history, and I wasn't able to provide them as much information as I would like to. And with that, I think that at least opens the discussion to say, hey, you know, our auntie had this. Can you tell me more about it? Or, at what age was she diagnosed with her, women's disease? And can you tell me a little bit more about it in
Yes.
detail? Um, because I think really bringing home the notion of, their history really impacts your risk. So,
Yeah,
grandma may be having breast cancer. That affects the next generations,
that's right.
and then so I sometimes posing it like that, like, hey, I know you want to keep me as your daughter safe.
That's
Please
right.
share with me. I know you want to keep your grandchildren safe. Please share because that sharing really, really, uh, um, you know, helps the next generation. It really accounts for that prior history, so that we can, really safely screen the next generation, and the children, already present, but children to come as well.
Absolutely. So key. You are watching Let's Talk America radio podcast. I am Shayna Thornton. I am your on-air host and executive producer. I'm speaking with the one and only. He is a breast surgical oncologist out of Atlanta Metro. It is the one and only Dr. Christopher Jean Louis, and he is with us. He's a practicing physician, right? So sometimes people can have people on that are saying different things here and there. He is treating women with cancer every single day as a surgeon, okay? I do want to remind you right now, we have lots of people on. I want to see your questions. Thank you for listening. Thank you for being supportive. But we certainly want you to get questions or concerns in. We all know someone that had breast cancer. If you're a survivor, we want to give a shout out to you, okay? But please don't be shy tonight. Get your
Mhm.
questions in. Many people say, well, I wish I had a doctor I could ask questions to. I don't know anyone that's connected like that. What we're telling you right now, you have a breast surgical oncologist on Let's Talk America radio podcast. He's here for your questions. Get them in, please. We want you to get them in for sure. I've got to ask this question, doctor, and you've, I'm sure, seen super young women and older women, but the average age of breast cancer, what age does that tend to be? And I'm assuming, like anything, your risk of cancer goes up the older you get.
Yes. Yes. So the average age now for breast cancer is about 60 to 65.
Oh,
It's roughly about 65 for Caucasian women, a little younger. Black women about 60, but about 60 to 65 is the average age.
okay.
Now, the large majority of breast cancers do occur after the age of 40.
I
So
see.
that, yeah, so that's one of the many reasons why we start doing screening mammograms at the age of 40.
Okay, so that's so key to get those screenings in. And I would imagine if you had a mother or first degree relative, such as a sister who was diagnosed earlier, could it hurt, doctor, to simply say get that screening or mammogram at 30 or 35?
No, absolutely. The recommendation by almost all societies is age 40 or 10 years prior than that relative when they were diagnosed with
I
cancer.
see.
Yeah. So if, say, for instance, if our mother was diagnosed with breast cancer at 44, at 34, we need to start, some aspect of screening. Um,
Okay,
so
so
it's
yeah. So you're saying
40
don't
or
sit
10 years
by,
prior.
don't
Yeah.
sit by and just say, well, the guidelines say 40. You're saying
Yeah.
if that first degree, especially your mother, you're saying it's not a bad idea to go ahead and get that screening ahead of time.
It's recommended. It's recommended to
Yeah,
do it 10 years prior to when that family member was diagnosed.
yeah.
Because that individual is at higher risk if they've had, their mother, for instance, diagnosed at the age of 44. So
Wow.
we
So
start
key.
10 years prior. Yeah.
So, Key, we have a question out of Atlanta Metro. Thank you, sir. Mr. Glenn is with us. He says, great topic. Is breast cancer screening a normal part of the annual exam for men? Are there breast cancer symptoms? Such a great question because I know we talk about women over 40, right? It's kind of drilled in women, and you, along with you get your pap smear and you get your uterine check, but or uterus check rather. He's right. Do men, I hear my dad and others talk about a PSA test, but I've never heard any gentleman I know, and my father in particular, use him as a guideline, talk about a physician talking to him about the risk of breast cancer. You did share that it's 1% of men that do get it, but the risk can be there, and I'm sure it's higher, right, Dr. Jean-Louis, for men who may have a history of breast cancer. And are there symptoms for men? And we're going to talk about symptoms for women and men, and maybe you can compare those so everyone can be aware. You did mention that Beyonce's father, it was noted that he had a lesion on his chest. And we can dig more into that, what symptoms exist, but help us out. The screening for gentlemen, they talk about PSA, but hey, anything else?
Yeah. So that is a fantastic question, and the answer to that question is for men because the risk is so low. We don't typically get screening mammograms in men.
Okay.
Right? So the big thing with men is physical exam. So when we go for our annual physical with our general practitioner, our primary care doctor, when they check you from head to toe, your chest should be one of the areas that they check, and specifically checking for abnormalities, masses, anything out of the ordinary. All right. And then the other thing in men is that if we notice something that you notice a change, you notice a mass or a knot. Some folks may say a knot, or a nodule on the chest that, if it doesn't go away, and if anything, it persists and gets larger, that's definitely something we have to bring to our doctor's attention because that does need to be worked up. Most common manifestation of breast cancer in men is a lump on the chest somewhere that persists and gets larger. And the normally when we do find that, we kind of go through the same process. So that's when we would start with a mammogram, ultrasound, further workup, potentially a biopsy to assess this area and to see kind of what it is.
Yeah.
But
So yeah. So don't ignore it.
no, don't ignore it. And yeah, I always tell my fellas, we are not exempt. We are not exempt from breast cancer. And I've actually treated men with breast cancer, and the
Okay.
numbers seem to be climbing ever so slightly.
Wow.
So it is important that men we kind of knowledgeable and cognizant of our body. When we notice a change, just don't ignore it, specifically if it's persistent and it becomes more prominent. Kind of bring it to the attention of our doctor so we can get it addressed.
Thank you. Thank you so much. Thank you for our gentleman out of Atlanta Metro for that great, relevant question. On that note, I think we'd be remiss if we did not talk about the symptoms of breast cancer for women. And I know this may be somewhat tricky, Dr. Jean Louis, because for some women, right, if I'm correct, I've read this and we've had conversations about it before. Some people don't always have symptoms or physical outward symptoms. Is that true? And so for those that obviously do, that would be other things, and we'll talk about that. But what would be some obvious physical symptoms that for everybody, especially women listening, to be aware of?
Yes. So the majority of breast cancers that are diagnosed in the United States are asymptomatic. All right, are asymptomatic, meaning that women don't notice any symptoms. You don't notice any changes. All right, and they're caught or identified on our mammogram. All right. The whole premise with a mammogram is to catch something occult, something we can't see, we can't feel, we haven't noticed any changes, but may be present within our breasts.
Okay.
So the most common symptom with breast cancer is being asymptomatic. You don't notice any change. Right?
Wow.
Some symptoms that we can notice. So I always tell patients breast pain. Breast pain is usually not associated with breast cancer.
Okay.
Usually, all right. Only roughly about 10% or less of breast cancers present with breast pain. All right. And I say that because breast pain is a very common symptom that the women will have over the course of their life. With
Oh yeah.
menstruation, you can definitely have
Okay.
breast pain,
Okay.
but breast pain is usually not breast cancer. All right. But different things that we can see on exam. So the most common physical exam is a nodule. Again, a lump, a nodule, a knot, as some folks may say, that shows up on the breast that persists and does not go away. All right. Other things that we may notice or encounter is dimpling in the skin,
Okay.
where the skin, usually has a smooth contour, and all of a sudden it puckers or it kind of has an indentation in one
Okay.
particular area. The other thing that can sometimes be appreciated is nipple discharge. Um, Whenever we have a woman with nipple discharge that's coming from one side and that's bloody, that's one we kind of take a little bit more serious and try to work up a little bit more and investigate to make sure there's not a cancer causing that.
Okay.
All right. Other symptoms that can sometimes be appreciated is nipple inversion, right, where the nipple will kind of pucker in as opposed to being in an outward trajectory. If that Some women are born with that. Some women are born with that, and they have that pretty much almost the full duration of their lives. If that's the case, then that's kind of just your normal anatomy. But if it's new, if we notice, okay, all
I
of a
see.
sudden my nipple is inverted in, it's I noticed that for the last several months and it doesn't correct. If anything, it's getting worse. That could be another subtle sign.
I see. Okay. And so more importantly, and you've gave a lot of good information, look for bodily changes, right?
Yes,
Look for
yes,
bodily changes because you're saying obviously there are women who could, and this would be hormonal. I'm assuming you're the expert, not I. But for discharge, they can have other types of discharge, not always bloody. And obviously, they still need to speak with their provider about that. Don't just
yeah,
ignore it. But
yeah,
you're saying for some women, obviously that doesn't always mean cancer. And I guess so many times I've reported when I was a field reporter and doing this podcast now, Dr. Jean Louis, that a lot of things that do come up, even if someone finds a nodule or a lump, if you will, in their breast, obviously, there are sometimes and a lot of times when it is not cancerous, right? And
absolutely, yeah,
so, but I want to say that because I think so many times people, obviously we hear that C word and we freak out for obvious reasons. You work in the field of oncology, you know why people do, right? But there are times where, I would say all the time, that we need to get it checked out to identify what it is. It could be malignant or non-malignant. But I guess I want to just jump on this. Ignoring it doesn't take it away.
No, no, absolutely not. And I would prefer, I much rather prefer patients or a patient comes to see me and it's nothing. It's, this is a normal change. This is a normal finding. This is benign. I'd rather have that situation
Yeah.
happen 1,000 times as opposed to one patient come and see me and we have a cancer that is now more advanced because we didn't have it addressed in an appropriate, timely manner. So
Yeah.
so yes, knowing your body, I think, going back to kind of what you stressed, knowing your body is important.
Yeah.
I always, tell patients a self breast exam. I still advocate for that. I think
Yes.
that's a great
Okay.
modality to implement to know your body, right? And it's knowing your body, not somebody else's, not some other person, but knowing your body's
That's
baseline, right? And realize that the breasts are not static. The breasts do change, right? If we menstruate every month, our breasts will go through a subtle change with
okay.
menstruation. If we as we age, our breast changes, right? If we have fluctuation in our weight, our breast is going to change, right?
Okay.
But
Okay.
knowing your baseline is key. So that way, when something is outside of our baseline, right? This
Yeah.
this spot right here is I didn't notice that before. It's not something I'm used to seeing. It's a change. Bringing
Yes.
that to the doctor's attention so that we can address
Yeah. So it's such a great point that you're saying as we do age, and that's important that the body will change on us and to be attentive to it. And with weight gain, so many people, women in particular, well, their weight can fluctuate, but you're saying be aware of those changes, right? So we can have an intelligent conversation with the physician of, well, how long has this been going on? We're aware of it since we gained some recent weight, since we've been over 40 years old, and not, I don't know. I don't know. And I know people don't mean that in a malicious way for their own health, but we have to know what's going on with our bodies. And I'm going to say this, in a world where we have a whole lot of self searching on search engines,
it.
that Google, and no issue with Google, shout out to Google for all that it provides the world with knowledge, but you cannot self-diagnose yourself. You need to go see an expert like a Dr. Christopher Jean Louis to get to really get the full information. And I'll say this too, Dr. Jean Louis, that there's a lot of times people will scare themselves into situations because you and I both know when you can put in a common headache and 1,000 fatal things or causes will come up. And you're like, wow, wait, what? But when you go see an expert such as yourself, can get to the bottom of it and certainly give the true education that's deserving and not the worst of the worst that you're going to find in a common search engine. Am I right or wrong?
No, you're absolutely right. Using good, dependable, trusted resources is so important. Whether we've seen the doctor or after we've seen the doctor, using good, reliable resources is key. Because yes, social media is there. You have a lot of different sites that are going to try to draw you in by showing you the scariest, the biggest, the baddest, most
Yes,
dreadful thing. And the more clicks they get, the
that's
more
right.
financially they gain from that. So they're going to try to entice you to click on this. So So I think really exploring and going to trusted sources. Of course, meeting with your provider to get good concrete information is important, but good trusted resources are just as important to make sure we get good accurate data, and not just something that is going to just scare us, out this world. So trusted resources are so important.
And that's so, so key. Thank you, sir. We certainly appreciate that. We're going to keep going with the questions because we've got questions. Friendly reminder if you jumped in, if you're watching us on replay, but especially if you're live right now on Sunday, October the 20th of 2024. I am Shayna Thornton. I'm the host and producer for Let's Talk America radio podcast. And we are highlighting Breast Cancer Awareness Month. And we have certainly a very highly credible, highly recommended medical expert on with us, the one and only Atlanta Metro based breast surgical oncologist, Dr. Christopher Jean Louis. This is his world debut here on Let's Talk America. America Radio. He's a pro at it already, but he's taking questions, and we're going to be on for a few more minutes. But this is your opportunity, okay? People will say all the time, I wish I had a doctor I could ask. I wish this, and that. You have someone that's working in the field of surgery and oncology. Get those questions in. If it's not for you, it's for your mother. If it's not for you, it's for your sister. It's for the woman you love, your significant other. We all know women we love. And I will tell you this clearly. He pointed it out. Breast cancer is very relevant. It's very present for a lot of people, and you don't have to have a family history of breast cancer for breast cancer to pop up on you. Okay. We have Michelle out of Columbia, South Carolina. Thank you to the Carolina crew. She says, and she asked a great question. Are your chances higher of getting breast cancer if you had other forms of cancer previously? That's a very, very great question. Michelle, thank you for bringing that up, because there are lots of survivors of other cancers out there maybe going through it. Does breast cancer seem to pop up more if people have survived other cancers? Because I've heard secular world of people saying, well, they beat that cancer and then 5 years later, breast cancer came up. Help us out, sir.
Yes, ma'am. So yes, that is a fantastic question. Very, very good question. And it depends on first. It depends on what type of other cancers we're dealing with. With for instance, colon or lung or pancreatic. As far as a link between that and breast cancer, not necessarily. There have been, with ovarian cancers, gynecological cancers, sometimes with just the production of estrogen and progesterone. Sometimes there can be a little bit of a link or association between gynecological cancers and breast cancer. But the biggest thing, though, I think if we've had prior cancers and we develop another cancer like breast cancer, is at least exploring or having a discussion with our physician about genetic testing.
Yes.
Whenever we see individuals who have multiple cancers or concomitant cancers, diagnosed with one cancer and another one at the same time, that just at least cues us into potentially there could be a genetic mutation involved, kind of in this person's situation, where it makes them predisposed to have not only just one cancer but multiple different types of cancers.
Yeah.
So, you know, whenever we see that, or whenever I see that, you know, genetic testing really does become a point of emphasis. To at least explore that for the patient, but also genetic testing is important for the rest of our family as well, based on our results.
Okay.
Yeah.
Real talk for real people. You are watching, listening to Let's Talk America Radio podcast. I'm Shayna, on-air host and executive producer, the one and only Atlanta Metro-based breast surgical oncologist, Dr. Christopher Jean-Louis is on with us, and he's taking your questions. I've got to ask this, though, because it's a tough conversation to have, but it's one worth talking about. We all know that it has been well documented that the famous actress Angelina Jolie had genetic testing done. From my understanding, there were multiple members in her family that did have cancer, and it was fatal. And there are other well-known celebrities who have talked about it as well. For that, and I want to do real talk for real people. You mentioned genetic testing is certainly viable. Sounds like something you would recommend. But I've got to ask this. There's someone out there, somebody practical, somebody reasonable, somebody who may or may not work in the medical field, that's saying, Dr. Jean-Louis, they're going to say, well, you know what? I hear you, but do I really want a diagnosis of this is all the cancers and all the diseases that's pretty much waiting for me to have? This, doctor, you address the physical part of people, and you do that extremely well. There's also a mental, emotional part to it. And I don't need to tell you, because this is a fair balance show, that there are things obviously that testing shows us that doesn't necessarily always happen, right? I mean, I think the favors are obviously in favor of the genetic testing. But what are your thoughts on that for someone that's very hesitant? Because it's a real conversation. I see people out in the world, 50% are for it, and the other 50% is like, you know what? I'm going to do my screening. I'm going to do the healthy lifestyle things, but I'm not sure I really want that list of this is all you're going to get in life when you hit 50. Help us out.
Yes, and yes, we that is something we commonly run into, where, I'm very, liberal with genetic testing. I let patients at least know about it, that's an option. And you have a fair number of patients say that I really don't want to open up that can of worms. But with genetic testing, every breast cancer that I see, I let them know about genetic testing and offer it to them. Now, with breast cancer, only 5% of patients diagnosed with breast cancer will have a concomitant genetic mutation. So the minority of breast cancers will be, I guess, caused or be secondary to a gene mutation that we identify with genetic testing. As far as individuals who may be at high risk, who may have family members, and maybe genetic testing would be a good option for them. I let these patients know that with genetic testing, it just gives you more information. It really lets with this panel of genes commonly associated with breast cancer or other type of cancers, we test negative, right? And so that's helpful information. That's good information, and it's good for you, but it creates a ripple effect in the family where it's important to other members in the family. But even if you say, Lord forbid, we do test positive for a gene mutation, now we have information where we can kind of make decisions to potentially prevent the occurrence of cancer. And I think being in that situation, that's kind of a golden opportunity to say, okay, I'm at higher risk for something, right? Maybe I can disrupt that process. Maybe I could do something to prevent that from happening.
Yeah.
So you really are in the driver's seat with genetic testing, and specifically, if we have a positive gene mutation, you can make decisions to potentially prevent cancer from occurring. So you mentioned Angelina Jolie. Well, the gene mutation that puts us at highest risk for breast cancer are the BRCA mutations,
Okay.
uh, BRCA1, BRCA2. All right, these cancers put us, different studies kind of quote different percentages, but 60 up to 80% of women who have these gene mutations will have breast cancer over the course of their life. So
Wow.
very commonly, I'll see women who have this mutation, and it's like, doc, is surgery an option to maybe prevent my cancer risk? And
Okay.
absolutely it is. Are there potential strategies that we can do to maybe watch me a little closer? There
Okay.
absolutely is. So, with genetic testing, it just gives you more information. It really puts you in the driver's seat. And if we do have a positive gene mutation, we have that much more ammunition to make some decisions to decrease or potentially, nearly eliminate our risk for cancer, our
Yeah.
particular type of cancer.
Yeah, and certainly we saw the actress Angelina Jolie, sir, um, take some really I don't want to say drastic, but measures because if I'm correct, I'm not sure on this, but it was reported that she did have a double mastectomy, but there was no cancer detected yet. Is that correct?
That is correct. She had
Oh,
she with her situation, she had a BRCA mutation, and she had what we call prophylactic mastectomies,
okay,
where no diagnosis was made as far as breast cancer, but she just prophylactically, preemptively had
I
her
see.
breast removed because her risk was so high.
I
You know,
see.
when you
Got it.
have individuals that are BRCA positive, sometimes it's not a matter of if, it's a matter of when.
Okay, got it.
She prophylactically had mastectomies with reconstruction. So if you see her now, it's like, wait, I thought she had her
Yeah.
breast removed. Why is she wearing that dress like that? And
Okay.
yeah, that's she's had mastectomies with reconstruction. So reconstruction is another option where
Yeah.
you want mastectomies but don't want to be flat. You can reconstruct the breast to kind of recreate the normal bust of the breast.
Yeah, I have heard, and tell me how true this is. I've heard some individuals say that as a woman get older, obviously her risk factor goes up for breast cancer, and you shared that with the show at the top of the segment. But they're saying if women live long enough, most women will have a diagnosis of breast cancer. Is that true?
No, not
Okay,
necessarily. The risk does go up as you age,
I
so
see.
that is true. But it's not a situation of, okay, this person is 90, they live to be
Okay,
95, they're gonna get breast cancer in those 5.
I see.
No, it doesn't work like that.
So you're saying there are lots of elderly women who've never been diagnosed with breast cancer.
Oh, absolutely. Yes,
Okay.
ma'am. Yes, ma'am. Yeah.
So you're saying not necessarily, but it's all about being empowered with health, with the knowledge that's out there. You're watching Let's Talk America Radio podcast. I'm Shayna, on-air host, executive producer. We're on with the one and only Atlanta Metro-based breast surgical oncologist, Dr. Christopher Jean Louis, and he's taking your questions. We're only going to be on for a little bit more, so we love to hear the questions coming in. Michelle D. out of Atlanta said, "Hi, Shayna and Dr. Jean Louis." Hello, Michelle. Glad to have you on. And Rochelle it has a great question. And Rochelle Rodriguez out of Atlanta, she says, are there any suggestions on lifestyle changes or lifestyle improvements to avoid the chance of breast cancer? Great question.
Yes. And yes, there are. And Shane, I know you were at that talk that we did just recently this past
Yes.
week. But yes, I always stress to patients there are modifiable risk factors and non-modifiable risk factors. So things you can control and things that are completely out of your control. All right. So you can't control family history. You can't control, mom, grandma, their diagnoses, their treatments. You had no control over that. Right. Sometimes you can't control having a biopsy. Sometimes having a biopsy and having a high risk lesion identified puts you at higher risk for breast cancer. So, and you can't control that. But as far as modifiable risk factors, things that you can control, you know, I always I always harp and I feel like the two biggest ones are diet and exercise.
Okay.
Diet and exercise. And I encourage every person, every patient, every individual, male or female, it doesn't matter. But when you go grocery shopping, when you go to the grocery store, if you purchase an item that is boxed, is in a can, is packaged in some shape, form, or fashion, just turn it to the side, and
Yes.
look at the nutrition facts. All right, look at the nutrition facts. And with looking at the nutrition facts, if you see certain things that jump out to you, all right, this item has so much trans fat, or this item has maybe half the sodium you need in just just kind of one portion size, more than half the sodium you need in the whole day, or it has an excess amount of sugars. Those might be items that we may want to put back, right? May want to maybe look at another option because maybe that might not be the best option. But nutrition facts tell you a lot about a product and how it's going to affect you. So nutrition facts, I always encourage patients to look at the nutrition facts. And then the second item to always look at is the ingredients. The
Okay.
ingredient, right? What's in our food, right? And usually with the ingredients, if you cannot pronounce any of those items under the ingredients, that probably shouldn't be something you purchase, right? If it's got more preservative than it does, products you can pronounce, we probably shouldn't purchase it. I always tell patients as well, if high fructose corn syrup is one of the first three items listed under ingredients, you should consider another option. All right. But really knowing kind of nutrition facts and then ingredients, that really makes a big difference, right?
Yes.
So nutrition is important. And then the other thing with nutrition, I understand is, sometimes you just got to grab something. Sometimes, you
Yes.
on the go and family
Mm,
just needs to eat and you got to make do with what you got. You know, as far as food, making the best decision with the options you have
I
is
see.
key. Is key.
Yeah.
If you can eat sea moss every day, perfect. If you can eat organic every day, perfect. But the majority of us can't do that, right? So just making the best decision with the options available to you is key. All right.
Yeah.
And then the second part is exercise. And
Okay.
with exercise, I know that's another tricky element. Some of us, maybe can't do as much as we used to when we were, younger or several years back, but at least committing to do something every day,
Okay.
something every day. It,
Love
it
it.
may be just taking the stairs at work as opposed to taking the elevator.
Okay.
It could be just, I'm just gonna go for a walk around my block and I'm coming right back. It could be something as simple as I'm gonna do squats
Okay.
before I eat my dinner. Just commit to do something and implement it before the sun goes down. Right, is key, and it doesn't have to be anything like significantly strenuous. Nothing that causes you to pass out or be sore for several days, but just something. Right. So diet, exercise are key, and then simple things like smoking. Um,
Yes.
smoking is a risk factor for every cancer. Right? So not
Mm.
just breast,
Okay.
not just lung, but it's a risk factor for every cancer: colon, skin, brain, cervical, ovarian, you name it. Smoking is a risk factor for every type of cancer. Uh,
Let me expound on that because we've heard that for so many years, especially my generation, the Xers, the campaign of smoking and lung cancer, and you're saying it's not just the lung cancer, which is the obvious one, when you're inhaling, you're talking about cervical, it increases it for others. As you know, the world of smoking has evolved for a lot of individuals. Now they have vaping, and how safe when it comes to breast cancer risk, because we know that smoking, I guess cigarettes, if you will increase your chances. But what about vaping? And what about cigar smoking? Because there are a lot of women in certain urban cities where they are partaking in cigar smoking. Does that increase their risk?
Yes. So the most robust data we have as far as the correlation and link between smoking and cancer is with tobacco-based cigarettes, right?
Cigar, okay.
As far as vaping, we there have been data to show its detrimental effects on a number of items, our airway, our lungs, etc. But as far as the direct link to cancer, we don't have as robust a database or as much
Okay.
information as we do on just cigarettes. So vaping does have some deleterious and some detrimental effects that we've discovered. But as far as the link with cancer, still trying to accrue data to really show a direct correlate there as far as vaping. And with cigars, we kind of look at that and treat that the same way as cigarettes. Now with cigars, there's a little bit of variability. Some folks will use different type of tobacco product. So cigars, there's a little bit of variability there, but cigars and cigarettes, we kind of look at that the same. We don't
Similar.
have as much data on vaping just yet.
I see. Not yet, but I would imagine, I'm sure you're saying to just side on the caution of logic,
Yeah, yeah,
if
yeah.
we will.
Yeah,
Yeah.
exactly. And you may say, well, it doesn't. There's no data to say there's a link between vaping and cancer, but there's a lot of data to show there are some detrimental effects to your overall general health with vaping. So, I know it's a cancer talk, and this is Breast Cancer Awareness
Yes.
Month, but in general, vaping also causes a lot of detriment to your overall health
Yes.
outside of cancer.
Yes, and I'll say this: I sure wouldn't want to be on the wrong side of destiny, if you will. There's some things you can, and we know this, you can do everything right and still get diagnosed with cancer or heart disease or diabetes. We know there are people that have been very conscious of that. But we're talking about things that we can control. And to your point, I do want to point out that the World Health Organization over the weekend did release some top tips to help avoid and cut your risk of any cancer, of heart disease, and also diabetes. And guess what? It was everything you just said. It says try to stay active, try to eat healthy, avoid smoking. And it did say, also mention something about avoiding air pollution as much as possible, which becomes a little more difficult, obviously, depending on where you live. But it's some of the what you're saying, some great tips to keep us all as healthy as possible, not just for the C word of cancer, but for heart disease as well, which tends to be a leading cause of death, right?
Exactly. Yes. Of course, breast cancer, colon cancer, prostate cancer. The number one killer in the United States is still heart disease,
Wow.
cardiovascular disease.
Still heart
And
disease.
so, the diet and exercise is even that much more important in regards
Yeah.
to our overall heart health. So yes. So and I saw that same article that
Yes.
you mentioned. But yes, diet, exercise, refraining from smoking, excessive alcohol. The other thing also that it's important, and this ties to nutrition, is trying to refrain as best we can from ultra processed foods.
Yes.
That's another
Yep.
thing. If we can, sometimes our options are limited, but if we can, trying to at least minimize or refrain from ultra processed foods is
Yeah.
important.
That's such a great point to certainly, and that goes into eating healthy and having a balanced diet as much as possible. And something I recently heard you saying, I want you to expound on, sir, before we get ready to head out. Last call for questions or comments or feedback, or if you have any positive testimonies related to breast cancer yourself, let us know. But you also said, you touched on it a few minutes ago, do something. So you're saying even right before you go to bed, you were saying this,
Yeah.
walk around the room, walk around the house, pick up the weights. Because I think so many times we think of big changes. I'm going
Yeah.
to lose 30 pounds. And we know that's very, very hard to do without some sort of motivation or help of medication people are on. But I think when it comes to being able to say, I can do something one bit at a time, you're saying that makes a difference too in your fight in your fight to help prevent cancers, right?
Yeah, absolutely. Just when it comes to going back to exercise, Yes, a lot of the societies will say 30 minutes of exercise, every day if you can accomplish it is the ideal. And that's just not feasible for some people, right? That's not feasible for some people, and that's understandable, right? But doing something is everything, right? Not just saying, hey, I can't get 30 minutes in today, so I'm just not going to do anything. No, just take 5 minutes, take 2 minutes, take 10 minutes, and just implement something to get your heart rate up, right? No matter what activity it may be, just something to get your heart rate up, and trying to stay consistent with that is key. So, even though it may be a little bit, a little something is everything when it comes to, exercise in regards to our overall health.
Yeah. So, so key. Thank you for that. Rochelle out of Atlanta said, in your profession and experience with patients with breast cancer, how do you handle or help through the decision making, making the decision of surgery, reconstruction, chemo, or radiation? What is your best advice to help someone through that? Such a great question, because you said it yourself. There's so many different options. You also said at the top of the segment, Dr. Jean Louis, that oncology and treatment is getting more specialized, right? We know more custom medicine that we're more so than ever before. But there's so many options out there. What would you suggest?
Yes, and that is the one beautiful part with breast, cancer care, is that it's not just like you only have one option and that's it, right? You have multiple options, right? You really can decide, okay, I feel most comfortable with that, or I don't feel comfortable with that. I don't like that option. So there are a lot of options, right? And it's good, but it can also be overwhelming, right? All these different medicines the doctors talk about, and these different therapies, and even surgery. Like, some patients are like, I don't know what surgery I want to do. But I try to do a good job, and I'm sure all breast surgeons do the same. But really try to do a good job of breaking everything down, right? Looking at all the pros, all the cons, and when it comes to different treatment options. So surgery, for instance, I always tell patients, the options with breast surgery, two big options is going to be, breast conservation surgery with a lumpectomy. The other option is a mastectomy. And then with a mastectomy, you have the option to do reconstruction or no reconstruction. And then the type of reconstruction you do, if you decide you want it, well, there are more options in that regard. But and then patients will always ask, well, what would you do, or what would you say, tell your mom? And I always, kind of just go back to the facts that with surgery, the difference in survival is this, based on the surgery you choose. The difference in recurrence is this, based on what surgery you choose. So that oftentimes will influence, or kind of, help the patients to make that decision. And then I always tell patients, it's not a right or wrong decision. Right? It's making a decision that you feel most comfortable with, right? So what
Yeah.
do I feel comfortable with? How do I feel about, when it comes to surgery, how do I feel about my breasts and, my body, and how, what am I okay with? What am I not okay with? And then as far as the other modalities, I try, and the other doctors, we do the same, we'll do the same as well, in stressing the benefit of the different treatment modalities, the indications, why we do it, and then the overall, decrease risk of recurrence, or the overall increase risk of increased survival. So really trying to really do a lot. And these visits can be kind of long. Sometimes new diagnosis hour visits can be an
Yeah.
hour, sometimes an hour and a half. But really trying to go over all the information, so by the time you walk out, it's like, all right, I feel more confident in kind of my diagnosis and where I stand. But also make sure you are an active member in your care, and the doctors just aren't telling you what to do and what not to do.
Beautiful. And be empowered, certainly. We have a listener or viewer who is saying testimony early detection is key, appropriate exercising, helping healing through the process of treatments. The individual also said breast cancer is not a death sentence. Be vigilant. Such a great point. There's so many survivors that are on out there. Thank you for sharing that with us. Rochelle Rodriguez out of Atlanta said she just rescheduled her mammogram online. This segment was so motivating and encouraging, and of course, very educational. Thank you, Shayna, for this. And thank you, Dr. Christopher Jean Louis for sharing your knowledge. knowledge and educating us on this topic, and that we as women avoid due to fear of what our results may be. This
Oh, and
Hey, can you hear me?
yes, I can. Yes, I
Yeah,
can.
thank you. Little
Yeah.
brief technical difficulties, but we're back on, sir. And I didn't want to interrupt you. Were you sharing something?
No, no. I just going back to Miss FK. No, that what she said is perfect. Breast cancer is not a death
That's
sentence.
right.
And yes, it's a scare. Nobody asks for a diagnosis of breast
That's
cancer.
right.
Nobody. And I always tell patients, when they come to see me for the initial consultation, I know you'd rather be anywhere else right now than sitting with me here in this clinic talking about breast cancer. But if we are diagnosed, it is something that we can overcome. All right. There are steps to overcome it. All right. It is a journey. And it's like I always tell folks, it's like going over a speed bump, right? It could be a little bumpy sometimes, and you kind of get, it's like, whoa, I wasn't expecting that. But we get past it. We walk through it together, we get past it, and we keep going on this journey of life. So, breast cancer is not something that is a death sentence. Even women who are diagnosed with stage 4 breast cancer,
Yes.
where it's spread to different parts of the body, we now have good therapies where the women live a long life.
Yeah.
I have a patient that has had stage 4 breast cancer, and she's 20 years with stage 4.
Wow.
So it's not a death sentence, but at the same time, it's something that we once diagnosed, it's like, all right, let's make up our mind that we're gonna get past this.
Yeah. And we certainly can push forward and have hope. And you've made your case that there's so much hope that's out there, so many different options. Everybody is different. I would encourage everyone, don't think of the negative as much as possible. Well, this happened to so and so mom or so and so sister. That doesn't necessarily have to be your journey at all. And educating yourself and getting the information and getting in there early and really being aggressive about it. And I love something you said, Dr. Jean Louis, and I want us to close on that when you said be empowered with your own health. And obviously, it's a very scary time for women or the men that may be diagnosed. And they're saying, well, if the doctor said it or if the nurse said it. But, and we talk about this a lot on this show where we've had medical experts just like you, and they'll come in and they'll say, if you don't feel heard, if you don't feel that you're being listened to, if you don't think you're getting the options that are out there, there's so many individuals with a cardiac surgeons, with a cardiologist, we've had dietitians, we've had gynecologists who have advocated, endocrinologists, brain surgeons who have said that you need to go and find someone that will listen, because it's a scary dynamic journey that these women and men are on. And I would imagine the last thing you want to do is feel you're not being heard when it's your body. Am I right on that or wrong?
You're 100%, you are right. And uh, that breaks my heart anytime a patient says, I feel like my doctor's not listening, or I dread going to see my doctor.
Oh,
I never want that to be the case. I went into this profession, for that reason. I wanted patients to say, all right, I'm going to see my doctor. I know he or she has my back, and they're going to do everything they can to take care of me. And that's the way it should always be. And
yeah,
if you don't feel like that,
yeah,
if you aren't getting that, then yes, we look for another physician in that field who will listen. Because I guarantee you that there are docs out there who will listen, who will take care of you and have your back. So
yeah,
if you feel like you're not being heard, or your issues are being dismissed, then we need to, maybe a second option is never a bad idea.
Absolutely, because time is of the essence with any medical condition, and there's certainly other ones out there that will listen. And I would imagine part of that journey of listening is also what's working and what's not, and how comfortable someone is. Because I would imagine, Doctor Jean Louis, that we're certainly more comfortable if we're being told the information, if we're being explained the information, and not being talked to or talked at. But
Right.
it's a collaboration between that physician and that patient. That collaboration is so key.
Absolutely. Yeah. 100.
Yeah. Ladies and gentlemen, boys and girls, if you were listening to us tonight live, we thank you. Great questions, great feedback. If you're watching this on replay, we do ask that you tag or share this episode with a family member or friend. None of us know where we'll end up in life, okay? No one has a golden ticket that's going to say you're not going to have health challenges. You're not going to have any challenges out there. Let's Talk America Radio podcast is committed to providing education for you. So whenever you encounter whatever you do in life, that you can maybe say, I remember Dr. Jean Louis saying this on Let's Talk America podcast, because there's something that we can gain from each and every segment. This is your show, okay? And we thank you for the questions, because it wouldn't be a podcast episode or any live streaming if you didn't ask those questions. And again, so many people say, I want the experts sitting in front of me. And when you have them in front of you, you got to take full advantage. Of course, Dr. Christopher Jean Louis is of course, a medical physician, board certified physician. Okay, he's licensed to practice. He is located in Georgia. Okay, and he is a breast surgical oncologist. Okay, so he's working day in and day out with real life patients. The information he provided was amazing, but I do want to certainly give you a friendly reminder. It was general educational information. For more specific information on your diagnosis or your risk factors or your pain that you may be going through right now, or a nodule or lump that you found, we certainly encourage you to speak to your own specific provider who can get to your records and who can check you out themselves. Okay, that's so key. Thank you for joining us. I'm going to let you get one last word in, Dr. Jean Louis. What would be your last pearls of hope or pearls of wisdom for anyone, men or women out there who are going through this, or they're afraid to go to the next step? You've seen so many success stories. What would be your words of wisdom to them?
Yes. And so yeah. So yeah, one of the things I always tell patients diagnosed with breast cancer is, whenever we have this diagnosis, the first place it starts is, I'm pointing at my head, but it starts right here. We gotta make up our mind that we're gonna get
Right.
past this, right? And once we make up our mind that we're gonna do everything we can to get past this, the rest is history. Even in advanced stage cases, patients do really, really well. Overall survival with breast cancer is really, really good here in the United States. So, really just kind of saying, all right, this is something I'm going to get past, and I'm going to keep moving on
That's
the
right.
road to the rest of my life. So, and
And
it's just
just a
time to be,
chapter in the book, but it's not your complete story.
yeah. And then I always tell folks, this is time to be nosy. Really inquire about family history.
Hmm.
Our family members' prior history, cancer history, so that way we know our overall risk. And then when we go shopping, turning boxes and containers
Yeah.
over to the side, right? And looking at nutrition facts and ingredients. And as far as exercise, just do something. Something
Yeah.
is everything.
Yeah. So key. Thank you for sharing that. And I'd be remiss if I did not also give you the opportunity, sir, for those located in Georgia or Atlanta Metro. How can they reach out to you in practice?
So yeah. So with Piedmont Hospital, they actually have a really kind of straightforward, really easy website. Really, Piedmont Hospital. They have usually a link where you can find your doctor, and you just type in the doctor's name, and the information comes up. So that's probably the easiest way. I have to work on my social media platforms, my hashtags and my Instagrams, and so I'm not the best. I haven't caught up with that just yet. So I'm working on that. But
Name.
just you just type in Piedmont Hospital. They'll give you click on the link to find the doctor and type in the doc's name. They'll bring up whoever you are looking for.
Awesome. Thank you so much. The one and only. He is breast surgical oncologist, Dr. Christopher Jean Louis. So excited to have him on the show. Great answers. What a great advocate for this arena. It's a tough arena to be in, but as long as you have caring, compassionate physicians like him working with you, of course, that journey becomes a little more tolerable because we're going to talk for real people. No one wants that diagnosis, but it helps to have someone that's advocating with you there to listen and to provide the education. More women, more men need that education. So key. Thank you so much for acknowledging and say great. Thank you, Dr. John Louis, for amazing dialogue. And thank you, Let's Talk America with O'Shana Thornton. Thank you for listening. And we ask you to stay with us and listen to us as we present new episodes. You know, again, we never know when we can go through things in life, but Let's Talk America, a radio podcast, is committed to keeping you informed, okay? Engagement is key. And we know you're busy. You've got a lot of things going on. There are 1,000 different places you could be tonight. But we appreciate you watching us live, and we encourage you to share this episode again, okay? There's nothing more important than your health. Your health is your wealth. It's truly your only wealth. We talk about so many financial things on this show. We've had all sort of experts. But again, we have to be here. We have to be able to be thriving to be able to have any other thing on that plate. And you've got to be here with us. And we've got to put that health first and foremost. You got to get your mammograms, lady, if you're over 40. If you've got first degree relatives, if it's a mom or a sister, you heard from the one and only Dr. Jean Louis, you've got to do it earlier. Breast Cancer Awareness Month is October, but all year long, we want our women to be aware and vigilant about their bodies and what's going on. And that's if that's breast, if that's cervical, if that's uterine, whatever else is out there, colon cancer, which is also a leading cancer, and lung cancer as well. Stay on top of your health, ladies, and to our gentlemen as well. Thank you for watching us, okay? This show is because of you only. That's the reason why we're here. We're going to keep going, keep giving us feedback. We've got so many people that will email us or DM us. If you want another topic on here, something similar, something different, let us know because we're all learning together. To the one and only Dr. Jean Louis, thank you. And thanks to each of our listeners and viewers. Stay with us. Let's Talk America Radio Podcast offers real talk for real people. And guess what? That's you. Have a great rest of October, ladies and gentlemen, and we'll see you soon. Take care.
Thank you.